Hello friends, welcome back to Endo Tales from Life. This video is going to be a little special because we are going to cross a very small and first milestone. Yes, we are going to reach 1000 subscribers for our Endo Tales channel. And in this video, I'm going to come up with something that is totally unexpected. I would not say this is completely clinically irrelevant, but this is not something subjected to clinical endodontics, but it has a huge impact for every dentist who practice, not just endodontics, who just practices clinical dentistry. Yes, I'm going to talk about ergonomics, which is often ignored, or I would say given the least importance, especially in the earlier stages of life, but the impact is seen in the later stages of life. Yes, we all know that dentists are more prone to musculoskeletal disorders. So this video we're going to talk or cover the basics of ergonomics. So this is, I would say, a part 1 video where I'll be talking mainly about the basic ergonomic design, ergonomic positioning of the patient and different chair positions that every student and undergraduate student and also practitioner needs to know in the earlier stages of their practice. And in the second part are the most advanced ergonomics. It is about the use of magnification, which further improves your ergonomics. So we'll also have a glimpse of that in this video, but this is basically the basic ergonomic chair positioning, patient positioning, and how you need to work as an operator to avoid a lot of musculoskeletal problems and also to have a better, easy, direct vision both for yourself and for your assistant. So let's go to the video. Ergonomics in dentistry. If we have a chance to ask a question to some of the most experienced dentists or dentists who are retired from their dental career, what is something that they regret the most? The common answer from most of them will be that they wished they practiced with better ergonomics in the earlier stages of their life and throughout their career, which would have given them few more years to practice and also would have avoided them develop few musculoskeletal disorders. Yes, dentistry is one profession that is prone to musculoskeletal disorders than any other profession, and this has been proved in the literature, and personally each one of us would have seen a few friends of us, seniors or teachers, suffer from this. So this is not just prone to, I would say, older generation of dentists. We have even seen this in youngsters and sometimes even in undergraduate students developing these problems. So that is the seriousness of this topic. In the earlier stages of our life, we concentrate more on the procedure and the procedure outcome, and in the process, we are so keen in locating canals, seeing lateral canals, or the final outcome. We don't care about the ergonomics or the chair positioning or the operator positioning. And in this picture, you can see that very clearly. So these are some of the common errors that we see or we ourselves make in our practice. So some of the dentists till date, be it beginners or seniors, I have seen them practicing standing dentistry, and some of my students are to be really surprised. They tell me that certain procedures like extraction or giving local anesthesia, sometimes they tell me that I'm very comfortable doing this procedure standing. So that is something that made me do this video. We need to understand that there is nothing called a standing dentistry anymore, and we need to have certain discipline and better ergonomic positioning to perform procedures that is as important as giving quality dental care to the patients, so that we as dentists can save ourselves from some of these destructive degenerative diseases that we are prone to. Some examples are low back pain, spondylitis, carpal tunnel syndrome, which are very common among dentists. So, before we go into the actual topic and to know what is the ideal ergonomics that is recommended, we need to know what are the different types of motions that we as dentists perform during procedures. So this movements that we make, especially with our hand, is classified as class 1, class 2, class 3, class 4 and class 5 motions. So the class 1 motion means it's the movement which involves only your fingers. And class 2 motions are those that involve the movement of the wrist. And in class 3 motion, these are movements that involve the elbow also. And in class 4 movements, it also involves the shoulder joint. And in class 5, it's the torso, twisting of the torso in total. So ideally, we need to restrict as dentists, we need to restrict our movements between class 1 and class 2. For this, the prerequisite is that my elbow should be at rest so that my shoulder is also in a neutral position, and the movements that I do or the procedures that I do involve only class 1 and class 2, which means the movements has to be restricted only to my fingers and wrist, and my elbow and shoulder has to be at rest. But some of the common errors are not just due to our lack of knowledge, it's also due to the selection of the dental chair and the operator's tool, which is very important. So you can see this. This is one type of dental stool that is very common in our practice. But the problem with this dental stool is, you can see here, I don't have an armrest where I can rest my elbow. So to restrict my movements to class 1 and class 2, it's very important for me to rest my elbow. The only way with this kind of chairs, maybe I would say, if at all you already purchased this, what we can do is you can slightly tilt or move the backrest towards the front and rest one of your elbow, but still the other elbow is unrested here. So what is ideal as a dental stool is, we need to have an operator stool with armrest and preferably armrest on both the sides. So the advantage of this is it gives me a very good neutral position where the arm is rested, which gives the rest to the shoulder as well, and my movements are now going to be restricted only to the wrist and the fingers, that is class 1 and class 2. As you can see here, once my elbow is rested and locked, now irrespective of the type of treatment that I'm going to do, irrespective of the area that I'm going to work, be it maxilla or mandible, the movements are going to be restricted only to class 1 and class 2. So to develop a good chair positioning or good ergonomics, first the operator has to position himself ideally on his operator stool. So before even adjusting the patient's chair, the dentist needs to sit on his dental stool, and there are two things that he needs to correct. One is the parallelism of the thigh. The thigh has to be parallel to the floor. And number two is the forearm, that is from the elbow to the wrist, also needs to be parallel to the floor. This is the first adjustment that a dentist should make. So you can see here, in spite of adjusting the operator's tool ideally, if the work area is not in the ideal position, that is if the patient's head or the patient's mouth is not going to be in ideal position, again you're going to have a problem. So this is one of the common mistake that people make. They keep the dental chair high, or so when you select dental chairs, most of the dental chairs look cozy when you buy them, but how you actually select a dental chair is choose a dental chair that can really go low in height. So this is a case where you can see here how a common mistake most of the time people make. I told you the forearm needs to be parallel to the floor, and this is a common error that we all make when the patient mouth is higher. Instead of adjusting the chair, people tend to get up from the sitting position and start examining or start doing procedures from this posture, which is going to be harmful. So the picture that we saw in the beginning, this is the same error you can see here. The work is at a much higher level than the elbow. So this is not only causing stress to the operator but also is going to cause stress to the assistant here. And standing dentistry has even more side effects to the dentist in the long term, as this is involving all class 5 movements for to the dentist. So after initial chair positioning, the second thing that the dentist needs to adjust is the chair. So what and how we need to adjust the chair is, as I already told you, the chair needs to be something that can really go down as low as possible. So that is how we select a good dental chair. So here I am going to keep the chair as low as possible. After I am sitting in a comfortable position with the thighs parallel and with my forearm parallel to the floor, the chair is adjusted in such a way that the patient's head is going to be at my elbow level. So this is going to be the same for both the maxilla and the mandible, though there are some differences which we'll be talking in specific in the coming slides. So once the patient is made to sit, you need to inform the patient that you're going to adjust the chair height, and the first basic adjustment that you need to make is bring the patient's headrest back to your elbow level. So this is the preliminary adjustment that you need to make to the patient's chair. So make sure you don't adjust your dental chair, I mean the operator's stool, after this, because I don't want to lose the preliminary things that I told you, the arm and the thigh parallel to the floor, so that I can maintain a good working atmosphere. So for mandibular teeth, there is a very simple guideline that you need to follow. The patient is positioned in such a way that the patient's head is almost at your elbow level, and after that you need to know that the mandible, when the patient keeps her mouth completely open, has to be parallel to the floor of the mouth. This gives the best ergonomics and a good vision to the work area. So as you can see here, we are going to adjust the dental chair in such a way when the patient opens the mouth wide, the mandible is parallel to the floor and the operator is going to have a good direct vision. And you can see in this video, the one video on the right is going to show you how or what the operator sees from this position. So even without much strain to the back or to the shoulders or to the elbow, and without the operator bending forward, going closer to the patient, he is still able to see both the mandibular right quadrant and the left quadrant in a very comfortable way. There is a subtle difference to the maxillary teeth. When it comes to maxillary teeth, the patient needs to be in an even more supine position, and the maxilla needs to be completely perpendicular to the floor. That's the only difference. The mandible needs to be parallel to the floor when the patient keeps her mouth open for mandibular teeth, whereas for the maxilla needs to be perpendicular to the floor of the mouth. So this means the patient has to be kept a little more supine, the chair has to be adjusted further. This is the basic guideline, but otherwise the tooth still has to be at the level of the elbow. So this is how we are going to work in the maxillary teeth. You can see I need to increase the chair height a little before I make the patient go into the supine position. And the operator slightly moves from a 10 to 11 o'clock position or even a 12 o'clock position for maxillary teeth, whereas it was 9 to 10 o'clock position for mandibular teeth. And from this position you can see that the operator is able to examine any part of the maxilla comfortably, and the procedures can also be done from the same situation. So this is the basic principles of ergonomics without complicating things further. I have tried to keep it as simple as possible, and the dentist needs to be thorough with this and make sure he implements this in his practice. The best way to see if you're doing this properly is by asking your assistants or your colleagues to keep clicking random pictures when you're working without your knowledge, and later when they show those pictures to you, you will realize, or it's the best way to analyze if you're working with a proper ergonomic posture. And you can see this, what we have discussed so far is only the basic ergonomic principles, and the ergonomics are going to get even better with the help of magnification. That is part 2. But I would always recommend people to get thorough with the basic ergonomics before going into this advanced ergonomics part with magnification. So the take home message here is that number one is the tooth that you're working should always be at your elbow level, and the elbow needs to be supported always, and the maxilla has to be perpendicular and the patient has to be supine if you're working on a maxilla. When you're working on a mandible, the mandible needs to be parallel to the floor. And selecting a good brand of dental chair is important. And how we do that is the dental chair needs to go as low as possible so that you get an ideal chair positioning for mandible, and the dental stool should also allow this. And you need to have adequate space behind the dental chair. The common mistake I've seen a lot of beginners do is they install the chair so close to the wall that is behind, there is no space for the operator to go and work in 11 or 12 o'clock position with the chair completely in the supine zone, which means it's impossible for an operator to work with proper ergonomics with such a setup. So really need to reconsider or reorganize your setup to because this is going to have a huge impact in the long term of your dental practice. And as I mentioned earlier, this video is going to be special. This video is going to bring us to this 1,000 subscribers mark. I know this is not a huge milestone, but this is something to cherish for me, because in the last 2 to 3 months, within 8 days, our subscribers are increased from 200 to 1,000 now. So I really thank you all, and to entertain and to educate you more, I'm working harder, and I'll also be sharing my educational content on these social media platforms. You can follow it here, and for people who are really interested to learn more of endodontics from us, can contact us and get enrolled in this comprehensive Endo 360 workshop. Thank you so much for watching.